Respira Vita Technologies is pleased to provide you with a quick and easy tutorial that will explain how to use and properly care for your portable mesh nebulizer. Our portable mesh nebulizers are made to treat respiratory ailments like asthma, COPD, cystic fibrosis, and many others. When you receive your nebulizer, unpack all of your items to make sure that everything has arrived safely, and check to make sure that nothing is damaged. We have included masks for both children and adults in this package for your convenience. Make sure to read through the instruction manual prior to your first use. Please do not discard this instruction manual as you may need to reference it for future use. Keep in mind that these nebulizers are a personal medical device and should not be shared with anyone to prevent the spread of infections or diseases. If this device is for a child, please make sure the device is operated under adult supervision. Charging your nebulizer. Before your first treatment, make sure to plug in your nebulizer as the battery will arrive without a charge. Plug the USB charging cord into a USB port that has an energy supply. Then plug the other end of the cord into the nebulizer. The light below the power button will blink blue until fully charged, at which point the light will display solid green. Make sure to unplug the nebulizer after the unit is fully charged to maintain the battery's longevity. Even though the battery in your nebulizer will last for 300 cycles, be sure to recharge after every use. We recommend that you make sure to recharge your nebulizer every 6 months, even if you do not use it. Before using your nebulizer, it is important to make sure to clean the nebulizer prior to your first treatment. After the battery is charged, open the reservoir by gently twisting the lid off on the top of the reservoir counterclockwise. Heat up some purified water to approximately 45 to 140 degrees Fahrenheit. Then fill the reservoir to the 10 milliliter mark with the water. Press and hold the power button for 3 seconds. The nebulizer will begin operation. Make sure to run the unit for 2 to 3 minutes. Press the power button twice to turn the unit off. Pour out the excess water. Separate the main unit from the reservoir by firmly holding the main unit and gently pulling up on the reservoir. Do not wash or submerge the main unit, but it is okay to wipe down the unit with a soft cloth or medical-grade alcohol wipe. Wipe all of the components, including the cap, inside the reservoir, outside of the reservoir, electrodes, and the outside of the mouthpiece connector with a medical-grade alcohol wipe. Be careful not to touch the metal mesh plate on the outside of the reservoir. This may obstruct the atomizing plate and inhibit the flow of medicine during use. Let the unit air dry in a well-ventilated area. Make sure not to use paper towels or tissues to dry any remaining moisture. These materials can leave particles or residue. It is okay to use medical gauze to wipe away moisture if you prefer, again, avoiding any contact with the mesh plate. Make sure that the reservoir sits for long enough to completely dry. Do not put away or store your nebulizer if there is any moisture present. Using your portable mesh nebulizer. In the event that you need to use your portable mesh nebulizer, simply twist the reservoir cover off counterclockwise to open the medicine container. Open your prescription solution and pour into the reservoir. Place the lid back onto the reservoir by turning it clockwise. Press and hold the power button for 3 seconds. The nebulizer will begin atomizing the liquid solution. Keep in mind there are 2 settings to dispense the medication. The initial setting is set to a high flow rate, which will disperse the medicine in a shorter amount of time. If you press the button once more, the nebulizer will switch to a lower flow rate, dispensing the same amount of medicine over a longer period of time. Consult with your pharmacist, doctor, or licensed physician to see which setting will work best for you and your type of medicine. Now it is time to attach the mouthpiece or appropriately sized mask included with your nebulizer. If you are using the mouthpiece, place the end of the mouthpiece in your mouth between your teeth and seal your lips around it. Direct the flow of the aerosol towards the back of your throat. It is important to remember not to obstruct the flow of particles with your tongue. Take steady breaths through your mouth until the solution has been completely dispensed. If you are using the face mask, hold the unit so the face mask covers your nose and mouth completely, using your face as a seal for the mask. again taking steady breaths through your mouth until the solution has been completely dispensed. Make sure to keep the nebulizer upright while operating. The medicine reservoir has been engineered to deliver all of the medicine when held properly. It is okay to tilt the unit slightly towards the operator. Most medications will only require one timed cycle or less. If there is still medication in the reservoir after one cycle, simply power the nebulizer back on by holding the power button for 3 seconds and selecting your flow rate. After-use care. It is very important to remember to clean your nebulizer after every use. Failure to do so may cause evaporated medicines to solidify on the atomizing mesh plate and clog the mechanism. When the treatment is done, make sure to pour out any possible remaining medicine by removing the lid and gently shaking upside down into a sink. Pour approximately 10 milliliters of purified water into the reservoir and place the lid back on. Gently swirl it around to collect any medicine that may have condensed inside the reservoir. Let the nebulizer run for 2 to 3 minutes and pour out the remaining water. Detach the reservoir from the main unit and take off the lid. Using a medical-grade alcohol towelette, wipe the surface of the reservoir starting from the inside of the cup to the outside of the cup and mouthpiece connector. Make sure not to touch the metal mesh plate in this process. To clean the mask or mouthpiece, simply rinse with water and wipe with a medical-grade alcohol towelette. Leave all of the pieces in a well-ventilated area to dry completely before storing. Do not wash the main unit. Simply wipe with a soft cloth or alcohol wipe.